So cilta-cel and ide-cel are two CAR T-cell products targeting BCMA that, based on results from CARTITUDE-4 and KarMMa-3, have recently been approved for the treatment of relapsed refractory multiple myeloma with 1 or 2 prior lines of therapy. While in prior studies, daratumumab-refractoriness seemed to be predictive of inferior outcomes with subsequent therapies, not all patients enrolled in the studies, CARTITUDE-4 or KarMMa-3, were refractory to this anti-CD38 monoclonal antibody. Therefore, we conducted a single-center retrospective analysis at Memorial Sloan Kettering Cancer Center, comparing the clinical outcomes of myeloma patients treated with CAR T-cell therapy based on their daratumumab refractory status prior to CAR T-cell infusion. In this cohort, we included a total of 127 patients treated with cilta-cel, ide-cel, or orva-cel, all of them autologous BCMA-directed products. These patients were divided in 2 different cohorts, a dara-refractory cohort and a dara-non-refractory cohort, and we evaluated clinical outcomes important for our practice. And our results show that despite more extensive prior therapies and higher rates of extramedullary disease, high tumor burden, and previous BCMA or T-cell redirecting treatments, their refractory patients had similar outcomes to non-refractory patients. Overall response rate was slightly lower in the dara-refractory group, and the 12-month PFS was also slightly lower in the dara-refractory group, but these differences were non-significant, non-statistically significant. And CRS and ICANS rates were similar across both groups with no notable differences in severity. Therefore, these findings suggest that BCMA-directed CAR T-cell therapies may still be effective for heavily pretreated dara-refractory multiple myeloma, despite a higher baseline disease burden and despite other features that would characterize more severe disease and more difficult to treat disease. But, however, longer follow-up and additional analysis, including a multivariate model, are planned to further validate those observations.